I'm Dr. Jyoti Arora. I'm the lead interventional radiologist at Apollo Athena Hospital. I have been internationally trained in breast imaging and interventions and have been doing high end procedures like MR guided VAB for last 15 years. So MR guided vacuum assisted breast biopsy जो टेक्निक है, दिस इज़ फॉर दोज पेशेंट्स जिनमें एबनॉर्मेलिटी सिर्फ एमआरआई पे दिखती है और रूटीन टेस्ट पे नहीं दिखती. सो दिस इज़ वेरी हाईली एक्यूरेट, very precise. It reduces the chances of undersampling and increases accuracy. This is a hospital for which is dealing with the women cancers in a holistic approach, and it's not like dealing with the other cancers or cancers for men. So that's why it's the first of its kind in Asia.
Through precision, compassion, and women-centric care. Today, we announce an important step forward, the introduction of MRI-guided vacuum-assisted breast biopsy or MRI-guided VAB, a development that significantly strengthens early breast cancer diagnosis. This minimally invasive, high-precision technique allows breast cancer to be detected and confirmed at its earliest stage and often before symptoms appear. Leading today's clinical discussion is Dr. Jyoti Arora, Senior Consultant and Lead, Department of Radiology, Apollo Athena, who heads Advanced Breast Imaging and Diagnostics and will guide us through the clinical significance of MRI-guided VAB. Supporting this initiative is Apollo Athena's multidisciplinary care team, Dr. Geeta Kadyaprath, Lead and Senior Consultant in Breast Surgical Oncology and Oncoplastic Surgery, and Dr. Jyoti Wadhwa, Lead Medical and Precision Oncology, ensuring that early diagnosis seamlessly translates into personalized and effective treatment. Together, this team represents what Apollo Athena stands for: early detection, precise treatment, and compassionate under one roof. To begin now, I invite all of you to watch a short film that captures Apollo Athena's vision for transforming women cancer care.
At its heart and dedicated to cancer care. Here, advanced medicine meets deep compassion. Like the plumeria, Athena embodies resilience, hope, and renewal. Every detail is shaped around a journey that deserves dignity, privacy, and comfort. Care that listens, supports, and stands with her all through. Behind every plan stands a collective of specialists. Cancer management teams collaborate, international molecular tumor boards guide complex cases, and genomic sequencing ensures care that is personal to her. Clarity begins here. Advanced imaging and preventive screening provide early, confident answers in spaces designed to ease anxiety she may have. Conversations unfold in quiet, private rooms. Therapies are delivered with precision by expert teams who keep each step reassuring. Healing needs rest and closeness. Thoughtfully designed rooms to give her privacy and be around her loved ones, while women-focused ICUs stand by prepared. Oncosurgeons blend skill with sensitivity. Hidden scar surgeries, fertility-preserving options, and reconstruction respect both medical excellence and her personal requirements. Treatment follows biology. Targeted immune or hormone therapies along with PARP inhibitors are chosen for effectiveness and precision. Season after season, plumeria blooms. Apollo Athena stands just as steadfast. Advanced medicine, teamwork that listens, and care that honors strength. Our vision is to lead with purpose, redress gaps in women's health, and advance science, dignity, and personalized care for every woman we serve.
The lead radiologist and interventional radiologist at Apollo Athena Women Cancer Center, the first of its kind in the Asia. So today we are going to talk about the launch of MR guided VAB, which is a very advanced procedure, but it brings certainty to women's cancer care. Now I hope by the end of my presentation I'm able to explain the significance of this advanced technique and how it bridges the gap in early cancer detection. And it's no more a medical jargon for you, but you understand the significance of it. So we all know about breast cancer. It's the leading cancer in the country. The cancer burden is about 27 to 28% in the women who have cancer. It is curable if caught early. Now, if you see the mortality or the death rates of cancer in our country, for every 2 newly detected breast cancer, 1 is dying of cancer. Whereas in the West, for every 5 to 6 patients that are newly detected with breast cancer, only 1 is dying. So there is obviously a mismatch in the mortality rates, and they are doing something better than us, that they are able to control their death rates. So let's see what exactly the difference is. We all know early detection saves life, and the survival rates are more than 100% if we catch cancer early. But many Indian women, they are diagnosed late, and many a times even those who are getting routine scans, they are also diagnosed late. One of the major issue is that in our country, the breast cancer is seen at least a decade earlier than compared to the West, which means the peak age is when the breast tissue is very dense. So dense breast tissue hide tumors on mammograms and ultrasound, the routine test that we do for breast cancer. This results in delays in much larger complicated surgeries, very aggressive treatments, and more emotional and financial strain to the patient. So that we have this narrative of catch the cancer early, but how can we if we can't see it? Now, just to explain what I mean when I say dense, this is the mammogram of a patient who is premenopausal. So all that white tissue that you are seeing is actually her breast tissue or her milk tissue. Now, the cancer is also seen white, and the white tissue against the background of white can be easily hidden. So this here that you see, this is a postmenopausal woman in which all the milk tissue or the breast tissue has now converted into fat, which appears black, and here the cancers. This is the cancer which is just announcing itself that I am here, because it's very well seen. A white tissue is very well seen on the background of black. But in this patient, if I tell you there is another cancer sitting which is much bigger than the one that I've shown you in the fatty breast, but it is completely masked because of the milk tissue or the normal breast tissue of the female who is still young, and this is the age group when in our country the breast cancer peaks. This is the MRI of the same lady, the dense tissue that I showed, and here you can see such a big abnormal area that is sitting in her MRI, which was not seen at all on her mammogram. But the story doesn't end here. We can see an abnormality on the MRI, but whether it's a cancer or it's not a cancer, this we cannot tell unless we do a biopsy. Now, the routine biopsies that we do for the normal easily seen mammograms, easily seen breast cancers, this we cannot do it under MRI. Those equipment, the MR is a huge magnet and our routine equipment doesn't work there, and that is the reason why we need this special technique which is called MR guided VAC to direct where the abnormal tissue is, take a small sample from there and then do the scanning or then do the pathology for it. So, introducing MR guided VAC, this is a procedure that we do in the MRI room under the guidance of the MRI. So here, this was a high-risk patient, this is her breast MR, and a very small abnormality that you can see here. So here you can see, and now MR with all its special gadgets that I'll be just talking about help us to direct our needle towards that abnormal spot. And in this case, we were able to completely remove that spot and send it for further testing. And our histopathologists tell us whether this is a cancer or it's not a cancer. So here we are getting clarity without delay on the same day itself. So what is MR guided VAB? Now when I say VAB, it's vacuum assisted breast biopsy, which means the needle that we put towards the abnormal spot, there is a vacuum attached to it, and with the help of suction, we are able to remove that abnormal spot or some tissue from the abnormal area that we see. The needle is guided with the help of the MRI, and so it's a minimally invasive procedure to collect tissue samples from that suspicious breast lesion. Now, guided by real-time MRI imaging, it's a very precise method of reaching up till the abnormal areas. So there is no surgery required to make the diagnosis. There is no scarring that happens with this minimally invasive technique. So steps are, first of all, we do an MRI, and we have very specialized MR with all the artificial intelligence special protocols that we are able to very precisely locate the area of abnormality. Then we have very special softwares which guide our needle towards that abnormal area with the help of vacuum assisted biopsy systems, which is another equipment that is required, which can go in the MRI room. Otherwise, the rest of the equipment cannot go in the MRI room because of the strong magnet that is there. So the tissue is gently sucked out and then sent to the labs for further testing. And this is how we come to the conclusion and we get the clarity whether an abnormality is a cancer or not. So I just wanted to show, if anything that we pick on the MR doesn't mean it is definitely cancer. These are all 4 different patients, almost same appearance. It's a line of enhancement or line of abnormality that we can see. And when we did their MR guided VABs, the first case came as DCIS or the stage 0. The bottom one came back as invasive cancer, but this was caught at stage 1. It's just like your eyelash. So obviously on the routine test you can never pick it up. The third one, this one came back as completely benign. In fact, it was completely removed during the procedure. So we could reassure the patient that she was all fine and nothing further needs to be done. And in the fourth case, it was an infection, and only thing that was required was a course of antibiotics. But what happens if we don't have access to MR guided VAB? Now this patient had lost one of her breasts to a cancer, so she was on a very close follow-up with MRI. And here you can see there is a very tiny little dot of enhancement or the abnormality which was suspicious. She didn't have access to MR guided VAB, so she was asked to come for a follow-up after 6 months. Now this time when she came, she has now developed multiple of those tiny little dots. So the abnormality, which was just 3 millimeters 6 months before, is now almost 30 millimeters. So it has increased by almost 10 times. And now she came to me, and because these are tiny little dots, they are still not seen on the routine test. So she came to me, I did the biopsy, the MR guided VAB, and this was confirmed to be cancer. So this procedure is a minimally invasive procedure, can be done as an OPD or a daycare procedure. No GA is required. We have very precise targeting and accurate diagnosis can be made, and this obviously reduces anxiety as well as uncertainty for the patient. So one test, one answer, same day we get the clarity. Now why this matters for India? Now I would like to ask the leading renowned medical and precision oncologist Dr. Jyoti Vadva, what are the challenges that you face in screening in India?
So very important question, and I think we need to know the truth about screening in India. So you may be surprised to know that even though we are talking,
That's there.
so even though we are talking about this, and we have Apollo Athena Women's Cancer Center, a center like this available to us, but in India, or the country if I speak, the screening adoption is less than 1% if we talk of the whole country. And the main reasons behind such low rates of breast cancer screening are many. And first and foremost is lack of awareness. लोगों को पता ही नहीं है कि स्क्रीनिंग टेस्ट भी होता है जो कैंसर को सिम्टम आने से पहले ही पकड़ सकता है. सो स्क्रीनिंग टेस्ट वो टेस्ट होता है जो हम एसिम्टोमेटिक इंडिविजुअल्स को ऑफर करते हैं. नॉर्मल लेडीज हु डू नॉट हैव एनी पैल्पेबल लम्प, हु डू नॉट हैव एनी apparent skin changes, who have no lump in the armpit, they are being tested to see if they have early stage of cancer in their breast. So screening test के बारे में awareness नहीं होना. Lack of awareness is the single most important factor. The other factor is that it is not even available. It is not even accessible. There are very few centers in India where even a mammogram is available. If we go beyond the metropolitan cities, most of the India which is residing in the urban, in the rural areas, or even in tier 3 cities, the mammography units is not available everywhere. Then we don't have experts. Here we have a leading radiologist talking to us about this advanced technique, but we do not yet have a radiologist who's trained enough to read a mammogram, isn't it?
But
so that's
you
another.
are lucky. You are sitting
Yeah,
in
we are lucky.
Delhi.
We are really
So,
fortunate. And
in a place like this, what's the challenge that you face?
so here there's another type of challenge now. So we in India see many young breast cancer patients. So almost 25% of breast cancer patients in India are less than 40 years of age. And when the person is young, the breasts are dense. And if to these women we offer only a mammogram or an ultrasound, we are very likely to miss exactly those types of lesions that Dr. Jyoti Arora showed us. So for those subset of patients, and herein we have to identify that subset, those with dense breasts, those who have strong family history of breast cancer or other related cancers, those who are carrying an altered gene like BRCA or similar high-risk cancer genes, they are the ones who should definitely be offered such a test so that they can benefit, they can get diagnosed in stage 1. So
Now,
that's where the
please
beauty of this
declare.
test lies. Yes.
So, I would now like to ask Dr. Geeta Gadaghrist, who is the leading surgical oncologist of the country. What are the challenges that you face? You advise a lot of breast MRs for these kind of subset of patients, the women with dense breast and women with high risk or with genetic mutations. Once their MR is done and we pick up small abnormality, then what's your experience then? What happens?
Abhi, we're sitting on the 20th of January and I've already seen 12 patients under the age of 40. That is very, very alarming. And sometimes you think कि इनको क्या बता सकते थे जिससे कि ये चीज़ को जल्दी पकड़ लेते. It is very tough to kind of get your head around these women. They say, I'm healthy, I do all the right things, exercising.
I'm getting my screening also done, but still.
But the screening for the 30 to 40 is very, very blurred still. But I think that is where an MRI comes into play, because if you have a dense breast, your mammogram is not going to tell you anything. Sometimes ultrasounds also miss it, and ultrasounds miss it because it is the person behind the machine, how you do it. It's dependent upon, it is operator dependent. So there is a probability that you may miss, आप उस कैंसर को मिस कर सकते हैं. तो ये जो 30 से 40 वाले ना, ये तो हमें बड़ा दिल दहलाते हैं हमारा. लेकिन पर मुझे लगता है कि कहीं कहीं अगर हमें थोड़ा सा भी लगता है कि ये चीज़ सही नहीं है अल्ट्रासाउंड पे, या हमें हाथ लगा के भी कुछ लगता है कि राइट नहीं लग रहा, आई थिंक वी शुड गेट टू द नेक्स्ट स्टेप एंड दैट इज़ एन MRI. और MRI से हमें कई बार ऐसी इन्फॉर्मेशन मिलती है जो बहुत ही सरप्राइजिंग होती है. आप एक ब्रेस्ट को देख रहे थे, पता चले कि दूसरे ब्रेस्ट में भी है, तो ये भी होता है. So we are seeing a lot of bilateral breast cancers, and I think that is how an MRI comes to help. और जैसे मैंने कहा कि दूसरे ब्रेस्ट में भी दिख रहा है लेकिन फील नहीं हो रहा, I can't feel it, but she can see on the MRI that there is something in the opposite breast also, and that is when she says that she wants to do a biopsy of the opposite breast. And so many times we have found cancer in the opposite breast. We were planning to operate on one side and we'll end up operating both sides. So this is not an uncommon situation. I would say not very common, but I think the assessment of the opposite breast also becomes very, very important. And with young breasts, it's a huge challenge, huge challenge.
And if we don't have this MR guided VAB facility, and if patients do not have access, and then I showed you a patient
That's
who,
right.
they are put, the only thing left for them is to put them on follow up. But once you put them on follow up, and if it is a cancer, obviously when it comes back to us, we have missed the boat. We have missed that critical time when we could have acted, when we could have saved not only their breast, but once we start treating cancers at an early stage, the treatments are less aggressive and they're more effective, and the survival rates are the best at that time.
That's right. Thank you.
So let's change the old story. MRI shows you something and it looks suspicious, but because we cannot biopsy it and confirm that this is a cancer, we say let's keep an eye on it, and the cancer slowly grows there silently, and maybe we have missed that boat. But the new story here is MRI finds something, we immediately do the biopsy and get a clear-cut answer. So action is taken when it matters most, and there is no more watch and wait and giving that anxiety to the patient. For the 6 months, you can imagine the patient having this anxiety that there might be something inside our breast which could be cancer. So MR guided VAC does not just detect cancer, it prevents delays, uncertainty, and the lost opportunity for cure. So here at Apollo Athena, we are doing this MR guided VAC, and we're very proud to lead the way in women cancer care with technology, innovation, and compassion. So just remember, not all cancers would be visible on routine tests. At times, MRI will pick them early, but it's only MR guided VAC which will help them diagnose, and that's the time when you can start your treatments early. So here I would like to showcase two of our patients. One of them had a very early sign of cancer, which is nipple discharge, but on her routine test, that is mammo and ultrasound, nothing was found, and she underwent an MR which showed subtle abnormality, but there was no way to biopsy it. So she flew from Goa to our center, and we did an MR guided VAC, which picked up a stage 0 cancer. So she could be treated early because she came here and got a MR guided VAC. Can we have a video? It's her son who is talking on her behalf.
Hi, good day to everyone. I just want to highlight a medical issue which was faced by us, and how the MRI guided biopsy helped us to detect the early stage. We are from Goa, and my mother had right breast, there was some discharge, and we did all the testing on the discharge, and the mammogram was done, but nothing was detected. So the doctor told us to do the MRI, and we did the MRI, and MRI it was found there is some tissues in the duct. So, but we are not sure what the tissue, whether it is cancerous or not cancerous. and it was decided that to know the exact what it is about the tissue, we should do the MRI guided biopsy. So our doctor, we are from Goa, so the doctor told us in Goa this MRI guided biopsy is not available. So he helped us in to contact Dr. Jyoti Arora from Apollo Athena. And when we contacted Dr. Jyoti, so he took all the reports of my mother to see what the report says that it is possible to proceed with the MRI guided biopsy. Then after checking the report, she said this procedure can be done. So we went from Goa to Delhi to do this procedure. It was a smooth procedure. We went in the morning and in the evening we went back from the hospital. And the MRI guided biopsy was done and the test results came after 3-4 days. And based on the test results, we came to know
Family history of cancer, and let's hear from her how this has helped her and helped her in reducing her anxiety and uncertainty from her life.
Good afternoon, everyone. So, a little context before I share my personal story with MI Guided Lab. In August 2024, my elder sister, who at that point of time was in her late 20s, she was diagnosed with breast cancer, and we went through all the treatment. And after her treatment, I was advised by the doctors to have routine and follow-up checkups. And before that, I also had undergone the genetic testing. And in the genetic testing, it came out that I had the same genetic mutation. So I was recommended routine tests so that I can be supervised and guided for precaution basis. And so in one of the precautionary MRI scans, there was some unusual growth in my right breast. So I was recommended MRI guided VAB. So we went through the MRI guided VAB, and fortunately it came out to be benign. It was a very small procedure and the results came within 3 to 4 days. But the wait was more difficult than the whole procedure, and especially for my parents who had already seen one of their daughters undergo the whole treatment. So it kind of really helped my parents and my family to reduce their uncertainty and anxiety. So I would really urge anyone who has a similar detection as mine to undergo VAB if they are recommended that, because it definitely reduces delays and it gives a peace of mind apart from the precision and accuracy because of the latest technology. Thank you.
Thank you, Priyanjali. It's
Reddy, Executive Vice Chairperson, Apollo Hospital Group, to come to the podium and share a few words.
Namaste, and thank you all for the support, for being here. And I would like to thank our amazing clinicians for being part of this dream and this vision. Because if it isn't for them, I don't think we'd all be standing here. I would be standing here and all of you in this room with me listening to what we've done. It is meaningful to come together because moments like this are actually historic. And in healthcare, progress really does not mean about adding technology. Technology is only one part of progress in healthcare. It's about closing the gaps in care, and we have spoken about it, but I know that there's a long road ahead. It's about reducing uncertainty. Especially in cancer, there is more uncertainty, and the certainty which we hear is actually quite scary. So if we can really flip that coin and make it better, it will be a job well done. And it's about giving patients the comfort of knowing that the best is available. And I think that is a commitment from the group that whatever is the best in care, whether it is proton or if it's a VAP or if it's a procedure, great surgical, precision oncology skills, we should be able to give the best to the patients, to the people of our country who trust us, and we need to do it unstintingly, and I think that's what's been special about the Apollo Group. It's actually just 4 months that we inaugurated Apollo Athena as Asia's first dedicated women's cancer care center. And the journey has been exciting. It has been rewarding. Small wins, but significant wins. And at this point, I'd really like to thank Priyanjali, who's joined us here, and the other patient's son, because it's not always that people come forward to talk about the trauma they have been through, and really be a torchbearer for the rest who may need this kind of care. So thank you for doing that for us. And I hope listening to you, a lot of people, their lives are saved. So I think what you've done is great. Our teams, of course, have worked with a very quiet urgency, I must say, that they really are people of substance, because Samarth is also here, so I can't even say women of substance. But having said that, I think they're a team of substance and a deep sense of purpose, and that is really translated into the vision becoming reality. At this point, I must also acknowledge the management team, which is, Shalu and John and all these beautiful young girls who really do much more than what is expected of them. So I think the team's been phenomenal. But what we've been able to do is to bring this technology to the center. And VAB is not something which is common. Only the best and the largest centers even attempt to do it. And doing it in a center which is barely 4 months old, I think is significant. It just proves the fact that, we want to make a difference and we want to bring the best in class. We also are committed to expanding this vision forward in different formats. I think Apollo Athena, as I was sharing with one of our team members, Apollo is the Greek god of medicine. And it was my sister Sunita, when we first started Apollo 42 years ago, one of the names which came up was Sushrut. And as a family, we just moved back from the US, and she told our chairman, she said, what a difficult word, I can't pronounce it. And we should be international, we should really signify what is global. So then, of course, chairman said, okay, what do you want to do? And so she said, can we call it Apollo, which is the Greek god of medicine, and it's also the sun god. And it just seemed like, very significant, so we did that. And at the same time, Apollo landed on the moon. So it was like, a good shagun. It was something which was good and significant for us. And we all loved the name. Everyone who works at Apollo loves the name. But when we started on Athena, I was trying to figure out, again, a name which is global, which has some significance. When I was thinking about it, talking to one of our doctors in the night, and he's 9 now, but my 7-year-old grandson said, Amama, why don't you call it Athena? It works very well with Apollo. And I thought, oh wow, what a great idea. And then I took it to our chairman, and he said, that's fantastic, because we have the Greek god of medicine, and we have Athena, who's actually a warrior goddess. She's the Greek god of war, so she fights battles, she looks fabulous, and she's a winner all the time. And that's what we want for the women in our country, for the women globally, that they should be able to fight their battles, come out strong, look gorgeous, because they're meant to look fabulous, and for everyone else to see that, women's health is so important to us. I also want to mention that, there is not enough focus on women's health. And it is not only a significant fact in India, but globally it is an issue that, not enough focus is happening on women's health. It's beginning, but it's not enough. And that is why doing this center for women's cancer, for women's health, is very meaningful to the Apollo Group. Because we want to do this because we really mean and we want to make a difference. We want to raise the bar on awareness. And it is the promise that whatever is best in class, globally, but whatever is best in class which can be developed in India. And I think today, research, newer technologies, better ways of doing it, integrative medicine, like, Jyoti is now doing a research project with Ayurveda, trying to see can we do something better. So I think as a country, we have to be torchbearers. We have to be torchbearers for the rest of the world to say that India means business. So while we do become the third largest economy globally, which will happen, we will also become a front runner for healthcare and medicine. And I think that will be the true vision and the true dream of all of us who are here today. So thank you very much for your time. God bless the team, and I'm sure that this is just the beginning. We're very young, we're only 4 months old, and in 4 months they've done a fabulous job, and there is so much more to be done. Thank you.
Thank you.